Urine crystals lecture. Crystals, they are identified by their microscopic appearance and their pH. Crystals and amorphous precipitates of certain chemicals make up what is called unorganized urinary sediment. Normal crystals are considered the most insignificant part of the urine sediment. Normal crystals that can be apparent, and on this slide we have divided them between acidic urine and alkaline urine. Acidic urine, you will see urine crystals that are uric acid, which is common in gout patients, amorphous urates, and calcium oxalates. Crystals frequently found in alkaline urine are amorphous phosphates, calcium phosphate, triple phosphate, ammonium biurate, and calcium carbonate. And a good rule of thumb to help remember that almost all of the phosphate group is alkaline. Abnormal crystals. Most abnormal crystals are found in acidic or neutral urine. And the first of the abnormal crystals is cysteine, which is typically in acidic urine and is caused by cystonia. Cholesterol is typically in acidic urine also and is caused by nephrotic syndrome. Leucine is also in acidic urine and is caused by liver disease or dysfunction. Tyrosine is also in acidic urine and is caused by inherited disorders of amino acid metabolism. Bilirubin is sometimes in acidic or neutral and is caused by liver disease. Radiographic dyes are from the administration of these studies and can be in acidic or neutral urine. And then medications such as antibiotics can cause sulfonamide crystals, which is due to inadequate hydration while taking these antibiotics. Crystals are usually the most apparent, can be strikingly beautiful, and the least significant in the urine sediment encountered. Important only if freshly voided urine that is still at body temperature. And it represents a nuisance since they distract from more important elements of the sediment that tell us much more about what is going on with the patient. Keep your focus on the important elements of the microscopic exam. So here is a chart of normal acidic crystals, and for our purposes, you need to know which crystals are acidic and alkaline and some of their shapes, and we will go through these in class. Normal alkaline crystals, here is the chart of the ones that fall in the alkaline region. So knowing which crystals are alkaline in pH, meaning 7 or greater, and their rough shapes, and we will go through the ones that are important to remember as triple phosphates, are amorphous phosphates and calcium phosphates, and also calcium carbonate. Amorphous crystals seen in acidic urine are amorphous urates. They are yellowish red to red-brown in color. They have shapeless granulation. They have a brick dust appearance to the urine upon refrigeration, and they dissolve at 60 degrees Celsius in a hot water bath. They are also soluble in 10% sodium hydroxide. Amorphous phosphates, amorphous crystals seen in alkaline urine are microscopically indistinguishable from amorphous urates. They are insoluble at 60 degrees Celsius, dissolve with acetic acid, or dilute with HCl, They are fluffy in white precipitate, and they appear like bacteria, and care must be taken not to overlook the bacteria which then may be present. So it is important to note it's really hard to distinguish by amorphous urates and amorphous phosphates. So it's important to note the pH when you see these under a microscopic exam and then report accordingly.